I am so pleased that so many of you were able to join us on this Monday morning, and I just want to give a shout out, first of all, to Ilene Mccaffrey, who is the Executive Director of the Community Music School of Springfield, who has welcomed us into this beautiful, absolutely beautiful space. And I hope that you can take in just the kind of both historic but loveliness of having arts in the center of our city. And I don't think Eileen's in the room right now, but I just wanted to give her a shout out. I also want to say thank you to, obviously, Philip Gonzalez and Tim Driver, who were the thinkers behind this opportunity to have everyone together and bring Dr. Kalache here this morning. So we have a lot to look forward to over the next couple of hours, and I would like to invite Nora Moreno-Cargi, who is the president of the Tufts Health Plan Foundation, up to give a welcome. So thanks, Nora.
Thank you so much, Jessica. Good morning, everyone. I actually had the privilege of driving down with two of my team members, and I stopped at Starbucks and said, okay, you do not want to see me decaffeinated. So we had to caffeinate Nora. And anyway, so good morning. I want to first off start by thanking my team. I have an incredible team. They have been really working hand in glove with the team, Tim Driver's team, and the state to make sure that what we were doing, the conversations that we were having around age-friendly, were inclusive. And so on behalf of the foundation and our board of directors, I want to add to those who are here a welcome. It's a pleasure to be in Springfield and to see so many of our partners here. I want to say I had the distinct honor and privilege of hearing Dr. Kalache on Friday, but then also sitting with him at the table at one of our partners' fundraisers yesterday. And I want to say, to have a world-renowned leader in the age-friendly movement, in fact, father of that movement, was so exciting and so inspiring. So I know that you're going to really enjoy hearing from him. Here in Massachusetts, we've seen some really incredible examples of innovation, of ingenuity, but most importantly, community engagement. Each of the innovations you'll hear about today are going to have different starting points, different emphases, but one thing is common around all of them, and that is that they listen to community, that they engage community, and they honor what that community wants and what older people need. It is a great time to be working in this arena here in Massachusetts. Our cities and towns are not only embracing age and dementia-friendly principles, but they're leaders, exemplars in the movement. We kind of have taken on the stark reality that we were the number 2 state to sign the age-friendly commitment, but I would argue that we were a leader because the way we started was in community, and we have momentum, and that's the thing that's really exciting, is to see that momentum. We have partners across sectors, from planning and transportation and housing, employers, health systems, public health teams adopting this idea of age-friendly, not only in their policies, but most importantly in their practices. And importantly, we have amazing champions at the highest levels of state government. I just want to add a personal note as I invite her up. Robin Lifson, who is now Deputy Secretary of the Executive Office of Elder Affairs, is someone that I met very early on in my tenure as the president of Tufts Health Plan Foundation. Robin and I share a common boss. I am from Chicago, so coming into this state was very, very hard. Not knowing people, not knowing like how to get home from work is really hard. But when you meet people who are welcoming and embracing, as Robin Lifson has been, not only in the work that we do on behalf of the community, but in her vision and her commitment to this work, has been rewarding. And so it is my pleasure to welcome to the podium the Deputy Secretary of Executive Office of Elder Affairs, Robin Lifson.
It's always hard to go after Nora because she's about 6 inches taller than I am. Thank you, Nora. That was lovely. Good morning, everyone. I am thrilled to be here. As my Cooley Dickinson friends know, I started my life at Cooley Dickinson Hospital, so I'm truly a Western Mass native, so it's always great to come out here, even though I'm not getting to Northampton today. What I want to talk about for a minute is why we are so fortunate to be in Massachusetts, and why I, in my role helping to run a state agency that serves older adults, why our orientation to this is really unique and really important. So the first thing that's special about Massachusetts is we have a governor who raised his hand and said, aging is important. It's an opportunity. We're becoming an older state. And we have to find the good in that. We have to find the opportunity in that. And in so doing that, he signed an executive order, created a council to look at aging, which consists of 24 people from all different sectors of the Commonwealth. And it's really through those conversations that a lot of our thinking about innovation in aging as a way to support our economy, becoming an age-friendly, optimal aging state, active aging state, whatever you want to call it, is really good for everyone who lives here. So that's kind of the first thing that I want to highlight about Massachusetts. And the second thing that I want to talk about is, as Nora had said, we were the second state in the country to raise our hands and say, we will make a commitment as a Commonwealth to become age-friendly. I'll also point out we're the best. We had the best plan, even though we were second. But what's really great about our plan is to support the plan of communities. We stand on the shoulders of communities. We stand on your work. We are not here to mandate things. We are not here to push a top-down plan, which is actually what has happened in some other states, one of which is just a little bit west of here and claims that they're first. Our plan is really about supporting communities and what they prioritize and what matters to them. We are wildly agnostic about how communities start, what their priorities are. We really want for this to work locally, whether it's a rural area or an urban area. So I think that's the second thing that's really special about doing this work in Massachusetts. And then the other thing I want to say is we have some amazing leaders, and we call them unusual suspects or unusual champions. When we started this work, thinking about becoming an age-friendly state 4 or 5 years ago, we all said, we need some unusual champions. We need people who don't do aging every day for a living. And interestingly enough, some of those champions have come from the business community. One of them is responsible for bringing Dr. Kalachi to us, and that's Tim Driver, who will come up next. And I think what's extraordinary about Tim is that he has a vision about how businesses supporting aging, whether they're businesses to support people who want to work, or whether they are businesses that address other parts of our economy, are fundamental to really leveraging our longevity economy and the opportunities that aging brings to the Commonwealth. And Tim had a vision about bringing a world-renowned leader here, and more importantly, about getting that leader out into venues that you might not necessarily put on somebody's guide to Massachusetts list. Last week we were at Fitchburg State University, where we had a pretty big crowd of very enthusiastic people, many of whom I have never met before. After doing this work for several years, I was surprised. Dozens and dozens of newly energetic folks to these conversations. Tim also put together an amazing gathering last Friday, downtown Boston, which was, I don't know, how many, couple hundred people, right? 300 people. 300 people. And it was really the first time I had ever sat in a room with a lot of my colleagues from aging, plus people from financial services, people from housing, people from business, people from academia, from philanthropy. So it was really a huge melting pot of people who were interested in aging. And it was an amazing conversation because we were talking to different people instead of to ourselves, and we were hearing different perspectives, and I think it really rounded folks out. And one of the most inspiring parts of the day for me was hearing Dr. Kalachi talk about his vision and his perspective, which I know he's going to share with you this morning, and I think he will probably inspire you as much as he inspired the rest of us. So without taking up any more time, let me ask Tim to come up. You're next, right?
Am I next? Jessica.
That's what it says on my notes.
Yeah.
Is it you? Sorry.
It is me, only because Dr. Kalache made a very wise suggestion, which is to have the panelists speak before he comes up so that he'll be able to hear and absorb what's going on. So we switched it on you, Robin, sorry. So next, I'm going to invite up my colleague, Sarita Hudson from Public Health Institute of Western Mass. Our colleague, Samantha Hamilton, took her husband on a surprise trip to Florida and didn't make it back in time. So you won't have the privilege of seeing Samantha, but you will have Sarita, who's equally as wonderful, and she's going to give a couple of minutes on age-friendly movement in Springfield. And then we'll have folks from the Berkshires and Northampton and the Pioneer Valley Planning Commission. So Sarita, where are you? I can't. Right here. There you are. Come on up.
Thank you so much, and I am privileged to be here to speak on behalf of the Live Well Springfield Age-Friendly, Dementia-Friendly Initiative. And I just want to recognize, and you can move to the next slide, we are the first city in the States, in the US, to have all three age-friendly designations. We have the age-friendly designation from AARP, we have dementia-friendly, with our Dementia Friendly Coalition, and our healthcare system, we have the age-friendly health system for Bay State Health and the health centers. So we are just so excited about all of the energy that has come through. And any of you, I just want, with those of you who were involved in this whole process, would you just wave your hand? Because I see a lot of you out here to say that this is a group, this is a process with residents at the center. I have our age-friendly Springfield community report, which is on our website at livewellspringfield.org, that we went through this process with a housing assessment, a transportation assessment. We involved residents at the center of the work through walk audits and community discussions and focus groups. So it really came out of all of this community work. And we have resident health advocates and senior resident leaders, I see one of them, Winston's here, that were part of this whole process. So that is what we are very proud of here in Springfield. And that these designations are a commitment that we will seek funding. We have the commitment from the Mayor Dominic Sarno, from Commissioner Helen Calton Harris of the Health and Human Services and Elder Services. It is a commitment to stay accountable to these residents who are part of the process and are advocating for services. It's a commitment to assess the other domains. We have our report on housing and transportation, and to look at this through age and dementia and with an equity lens. And it is a commitment that we are going to continue to advocate and bring awareness to this movement, and that we're going to work regionally, because so we're excited to be here with other folks in our region. And so that's what we're excited about and what we feel is really noteworthy about the work here in Springfield. And next slide. This is when we looked at what is the challenge. If we look at Springfield, and this is a slide from our Springfield Health Equity Report by the Public Health Institute. It's a life expectancy at birth by census tract. And premature mortality, defined as death before the age of 75, is a measure of overall community health. So Springfield has some neighborhoods, some areas where the lowest life expectancy of 70 years versus other neighborhoods with 81 years life expectancy. This is a huge challenge as we think about the health equity issues that are involved in addressing and making this an age and dementia-friendly Coalition. So this is something we are keeping top of mind in our work. So next slide. And so what are the innovations? We are very excited about all of these different activities that are going on and the different groups that are involved. We have our Go Fresh mobile market that goes to senior centers and addresses the food issues. We have senior resident health advocates from Wayfinders and our resident leaders from Public Health Institute. We have the work that's going on with the Bay State Geriatrics. We have this state-of-the-art senior center at the Ray Jordan Center. We have a new initiative on Fair, Free Tuesdays for seniors that will be addressing some of the transportation issues, and we're going to be evaluating that as we go along. And we have housing repair program that we are in the midst of starting with our partners with Revitalize CDC. So, and other partners working on how do we address the housing issues that have come up in our housing assessment. So these are just some of the projects that are going on. We are very excited for the next round of our work on age and dementia friendly.
Great job. Thank you, Sarita. Also, I forgot to mention that our partners over at In Focus Springfield are actually filming this session this morning, so it will be available to our residents at a later point. But for the next round of speakers, just make sure you speak into the microphone. Thank you. So next, I want to invite up Bobby Orsi and Laura Kitros from Age Friendly Berkshires.
Thank you. I should have followed you because I'm short too, so I'll stand on tiptoes. Thanks for inviting us to come today. Age Friendly Berkshires started late in 2014. I worked at Home Instead Senior Care, which is a private enterprise, a home care agency, and asked that big question, what's going on with older adults in our community? And was so fortunate to find the Mass Healthy Aging community profiles that became the resource for us and one of the drivers of why we needed to do something. So as I saw the huge percentage of people that were aging, I thought somebody in the community's got to be looking at this. And you know, they weren't yet. So I thought, who would be interested? And that was going to be Berkshire Regional Planning. And who else would care about seniors? And that would be Councils on Aging. So we brought everybody together to have that conversation in 2014. We followed that up quickly with the survey because that would be something we could energize people with. And it's been uphill so far. Can we have the first slide, please? So it's really interesting because, you know, when you start a new project like this, which was a culture change, there are going to be things that work and things that don't work. So we knew we had a great idea. We had, were fortunate to get the support from the Tufts Foundation to kind of bring this idea to work. And what we really, one of the accidental lessons was when we organized this team of active agers. And they were older adults, they were intelligent, they were motivated, they wanted something to do, and we didn't know what to give them. So we planted a few seeds, we talked about a few things, and this group actually didn't stay together. If you look back at 2014 and you look at this group today, they're doing things. Supergenarians, which is a group of people, older adults that organize huge community events for older adults on topics that matter. The Villages projects in the Berkshires came out of this group. The age-friendly video came out of this group. But if you asked me how the group worked, I'd have said it really didn't work very well at all. So we planted seeds. It's about planting seeds. And we've started, there's some little things that didn't stick up, but for all of those things, it took a lot of people to make happen. Next slide, please.
So I get the less fun, I guess I'm taller. I'm not usually tall. I get the less fun task of talking a little bit about our challenges and the things that have made our lives a little bit difficult. And a lot of it is about, as the title says here, erasing borders and changing minds. Like everywhere in Massachusetts, we have 32 separate communities. We don't have a county-wide infrastructure. But we know that the issues that go along with aging and the things that we want to change to make our community more livable and more age-friendly have to cross those borders. Our 32 municipalities, the majority of those are under 2,500 residents. They can't fix or they can't make everything age-friendly in each little town. We have to be able to erase those borders. We have to be able to do things on a regional level. And that's a mindset change. And it's a way of doing things and a way of thinking that we have to continuously hammer with our partners. And then just changing mindsets, turning things into a positive, taking this, problem of that our community is aging. The Berkshires is the second oldest county in the Commonwealth after Cape Cod. Many of our small towns, 50% or more of the population is over the age of 50 already. We have a missing young adult and children cohort in the Berkshires, so older adults are both a larger percentage as well as just sheer numbers in the Berkshires. So changing mindsets that this is a good thing, that if you make the community more livable for older adults, it's more livable for you and me, it's more livable for our children, it's better for everyone. So we have a lot of regional challenges: healthcare, transportation, housing, technology. As our Age-Friendly Berkshires coordinator, Peg McDonough, says, remember dial-up? It lives in Berkshire County. So especially, in some of the smaller towns. Needing resources to work regionally. The seeds are great, and we've seen a lot of just really wonderful projects come out of Age-Friendly Berkshires, but there's a need to do things on a regional basis, and there needs to be somebody driving that bus and finding those resources. We've had great support from Tufts, we've had great support from some other organizations, but it's hard to find. Stigma associated with aging and dementia, and just, as Bobby said, we started this in late 2014. We're now in late 2019, and it can sometimes be a little bit frustrating to think about what we haven't done yet. And we also did an annual report, and it was great to look back and see everything that we have done, because changing minds and changing the way things are done takes a really long time, and it's easy to get discouraged and think we're not doing enough. So it's really important to look back and see what we are doing.
I had just wanted to add that it takes everybody. And in our communities, we have a big out-migration of youth and a lot of seniors and people that are aging at home in their homes. The challenge is that we have this millennial mindset, and it's important to have this economic stability for us to all age into, but with a millennial mindset, it makes it even more challenging to focus on the needs of aging adults. So it's been one of the challenges that we've identified, and the Chamber of Commerce is on board. It's going to take a longer period of time to see some of that actually work. Go ahead. Next slide.
Next slide.
Okay, so when it comes to the fact that when you start this kind of project, you started, it was personal for a lot of us because we're all aging. And it's like, where do we want to be in 10 years? Where do we want to be in 20? What is the community going to look like and feel like? And how are we going to do that? So everybody needs to be involved, but you have to have a vision for where that's going to go. So it's nice to put people around the table and just talk about where do you want to be in 10 years. So, we have ideas around, age and dementia-friendly businesses. We don't really have those kinds of businesses right now, although we're starting to see some of them because they know they're catering to an aging population. Engaging volunteers, people that are retiring, have a huge amount of intellectual capital and energy to do some really good things. The challenge is, how do we actually move that forward? We have visions for tax credits, tuition reimbursement, those kinds of real incentives, but those are things in some ways that need to be legislated. Some of the changes in our payment structures for health insurance and all of that happens at an advocacy level. So advocacy is really important with state leaders. as is the investment in technology, like Tim Driver is kind of adding, I think, some information for us and some really good services. We know people want to age in place in their homes when that's appropriate for the most part. But it's going to take all of us, and it's going to take us adopting that idea that we can make a difference in our future. And it's engaging a community behind that.
So some of the other things we were calling this our wish list as we were doing this slide, like, what would it look like to us if we really did have an age-friendly Berkshires? There would be investment in technology so that everybody would have that ability in their home. It would be everything from telemedicine to communications. Really just continuing our education outreach and capacity building for municipalities, small businesses, and nonprofits. We've done some municipal checklists that we were talking about earlier today, so that municipalities know where to start. Because it's great to say, nobody's against, let's make the community more livable, let's make it better for our residents, but they don't know where to start. So being able to lend that assistance. Really just encouraging and seeing more intermunicipal resource sharing, planning, and economic development. Again, it's erasing those borders. It's the towns working together to do the things. And that has to do with some of these other things that are lower on the list around coordination of transportation models. It's everything from, can the councils on aging vans actually pick up somebody in another town as they drive through that town on their way to the hospital? Just kind of the things that our New England mindset, our Massachusetts mindset doesn't. We have to think about those things and make a conscious decision that we're gonna do those things. Housing is a huge issue. It's a huge issue everywhere in the Commonwealth. It's a big issue in the Berkshires. People tend to own homes. They tend to be house rich or house poor. I forget how that term goes. And people in the middle in particular lack a variety of options. It's stay in your single family house, which may be too big for you. The upkeep is difficult, the yard is difficult, but there aren't other options in rural areas, and probably not in other areas as well. And then the villages. I'm sure that most of you are familiar with this model that began on Beacon Hill that allows neighbors to help neighbors to age in place. And we're seeing huge interest in the Berkshires in forming village models. Again, everything takes time, everything takes an effort, everything takes a mindset to change. But that's something that we really want to work toward going forward in the next few years. Anything you wanted to add?
Yeah, just in closing. So our tagline is, age-friendly Berkshires, a great place to grow up, which addresses some of the millennials, and a great place to grow old, which really is about all of us. So thank you.
Thank you.
Thank you both. Now I'd like to invite up Cindy Langley and Marie Wesker from Northampton.
Thank you. Many of the folks in Western Mass think of Northampton as the really sort of hip place to be, place to go to a restaurant. Artists abound. And also, 20% of Northampton's population is over the age of 60. And that has been the case for 30 plus years. So we are, and it's also a retirement destination. So we are a destination point for a lot of factors, and which makes our involvement with age-friendly an important factor for all of us as we move forward in aging. Northampton was officially designated in April, this past April, as an age-friendly community. We have since then held 2 provider forums, 2 community listening sessions, trying to get some input about what would make Northampton an even better place to live. The folks who came in both of the consumer sections, this is a great place. I love it here. People are friendly, and I need more transportation, and I need affordable housing. I'm sure that's not unique to Northampton. And so those are the big infrastructure issues that we're all going to be challenged with, and obviously are not going to solve overnight. We're also starting very well from a strong foundation. We have a strong partnership with the city's planning department. The home of the age-friendly movement is the senior center, the Council on Aging and Senior Center. So we have a strong support from the mayor and strong community partnerships. I'm looking at our friends from Cooley Dickinson Hospital who were involved in some of the provider listening sessions. Northampton Neighbors, the Northampton Villages movement, has 800 members, amongst the largest village movements in the state. So we are building on this really, really solid foundation. Our first more public project is looking at age and dementia-friendly restaurants and businesses. We're going to be partnering with the Chamber of Commerce to really figure out how to do this in an effective way. And part of that is also looking at the city's own departments that are feeling that if we're going to go out and talk to businesses about how they can be more age-friendly, we ought to be looking at home first. So it's a whole way of starting and thinking differently. And as I said, we're starting with a really solid foundation, which I think we're all very happy and proud of. So next slide.
Hi, I'm Marie Westberg. So we're, as part of our process in working with the city planning department, is to be looking at the housing and transportation options. And I think we all know that transportation is always, I think, a very tricky thing to provide. And so coming up with creative options is a big part of trying to solve those problems. So the Senior Center providing a lot of transportation, but partnership with the Village Movement has been a big part of trying to solve the gaps in services. I think that more and more people are becoming members of the Village in Northampton, which is called Northampton Neighbors. And that sort of helps to supplement the gaps that we can't fill because we can't cover everything. And then new initiatives like PVTA's Senior Free Tuesday Fair program has been becoming very popular as well. And then housing, of course, I think, even though Northampton is working on housing, there's a real need to develop more universal design. I think that is ultimately the thing that is the most people-friendly, because I'm also the ADA coordinator for Northampton, and anyone who's aging may encounter disability at some point in their life. But also there are a lot of people with disabilities or families with someone with a disability, and I recently went to a housing assessment meeting where people talked about how they couldn't go visit their neighbors because their neighbors' houses weren't accessible. And so how do you build community without really looking at universal design for everyone? And so having housing downtown is a great thing for the economy. It's also a great thing for people who are aging because then there's less need for transportation, of course. And so Northampton's been doing a lot with tactical urbanism. And so getting the whole community involved has been really a great driver for change, I think, because people then can actually see something happening on the street that could be different, that could be something they might not have been able to imagine. And I think that's a real eye-opener for people who might not know what age-friendly means. They might say, well, this applies to all of us. So, and then the other thing is just we're realizing and working with community partners that we all are experiencing direct care with our patrons who may not be hearing about all the different services, and we might not even know about all the different services. And so if we don't know what you provide and you don't know what we provide, how are we going to help our consumers know about everything that's available to them? So really building an effective system of collaborative care is, I think, like Cindy was saying, is we need to start where we start at and think about it from the perspective of the people we're trying to serve. And then as the ADA coordinator, there's a lot of overlap as well in terms of not just educating the consumers about what's available to them, but also educating our coworkers and our other departments in our organizations about how do we work with people who have different needs? How do we be sensitive to all the different kinds of needs that come to our facilities and be aware about how we're using language and talking to people and providing them with information they need. The next slide. Oh, that's me again. So I guess the tactical urbanism is one way that we really like to build awareness in the city on the ground floor. And with the speaking about, I guess I just covered all these things, talking about things in an inclusive way and really appealing to that every family, every person has a different experience of their community. And so I think bringing people together around those conversations is really important. And so in Northampton, you can see all the yellow, all the orange cones are sort of blocking off the parking areas and turning the street into a more accessible city just for the day downtown, where pedestrians could feel like what it would feel like if you bumped out curb cuts and sidewalks, and that cars had to really slow down. And what would it be like to sit on the street in a parklet, in a little mini park, in a parking space, and how that just changes the whole feeling of downtown, that people are sitting and conversing and hanging out, and that bikes and wheelchairs and strollers are all sort of not feeling bombarded by cars as much. So it's one of my favorite things to do, because it really shows you what can change so dramatically by just some really small changes. And I think that not everybody can always understand what those small changes can do unless they actually experience it. Like, you can read about things, but actually being there and sitting on the street and seeing bikes just zooming by, not having to deal with cars because there's a special lane that's between cars and the sidewalk, makes a huge difference.
I think I just want to add, I think the other thing we're trying to do is really look at our language. And fresh from a reframing workshop from last week, really look at, and one of the pop-ups that Marie was referring to in the small section of Florence in Northampton, Smith College students, University of Mass students, really did sort of the lead in designing all of this. And in this morning's local paper, there was an article, and it was referred to, and this was paid for by an AARP grant, as I look at my AARP friends and colleagues over there. And I think the second or third line was, and it was good for the elderly people in the city. So we have a ways to go in working with our friends and colleagues and how we think and talk about it. But I think we're making a good start, and we're looking forward. Thank you.
The thought that Northampton can have more traffic calming is beautiful. That's unbelievable. So last up for our regional panel, Becky Bash from Pioneer Valley Planning Commission, doing work in South Hadley, Holyoke, and Chicopee.
Thank you. It's great to be here, and it's great to hear all the other stuff that's going on in the region. You can put it on the first slide. So the Pioneer Valley Planning Commission represents 43 cities and towns in Hampden and Hampshire counties. And unlike the Berkshires, we have more urban communities. We have 4 gateway cities, a number of former industrial cities and towns, the larger towns in the Springfield metropolitan area, as well as a number of rural communities up in Hampshire County. We've been involved in working for healthier communities for a number of years. We authored a Healthy Communities Design Toolkit, which included a second edition on healthy aging, and it provides communities with a checklist, basically, of planning and zoning tools that you can use to create more healthy communities. We've also been involved with food security planning and helping communities with complete streets, prioritization plans, and policies to make more walkable cities, and also worked in Mass in Motion. But for the last year, we've been assisting the cities of Chicopee and Holyoke and the town of South Hadley and also working with the town of West Springfield on developing age-friendly assessments and plans. And in doing this work, we've helped these communities with researching the tools that are out there, getting the surveys online and helping analyze the results, holding listening sessions, and writing the plans. So really sort of providing some staff support for councils on aging that may not have the capacity to do that. And as some of my colleagues have also been working on planning for more resilient communities, what has struck me about this process is the cross-sectoral collaboration that's involved. We've been meeting with multiple municipal staff departments, as well as businesses, service providers, and we could expand much further. But this is also a great opportunity for learning to plan for the culture of health and caring for all members of the community. For example, the subject of transportation always comes up in our communities, and it layers on discussion of need for transportation for other vulnerable populations. A few sub-regional efforts have come out of the need for transportation by expanding the use of senior center vans, and in the case of the Quabog Connector, it's really a multi-community transportation service provider that helps seniors as well as other members of the community. So we've been talking about smart growth or locating housing in town and urban centers for years, and that communities should adopt complete street policies and programs to create more walkable communities. By adding the age-friendly lens to this work, I think we can find broader community support for these concepts. There seems to be an overall understanding that we need to prepare for an aging population, and I think in part because we're all aging or know someone who's aging. So it seems to me that this opens up an opportunity to engage a broader community in discussions about smart growth and the importance of walkable communities. Next slide. Unfortunately, there's a disconnect between housing for an aging population and the current reality. Participants in listening sessions and responses to the Livable Communities survey indicate that when people want to downsize, they often look for housing in town and urban centers, and it's not always available. And for example, a couple of people in one listening session that I had said they were looking for single-floor housing near a community center. They weren't able to find it, so they chose being close to the center rather than the single-floor housing. And there are multi-year waiting lists for affordable housing units in some communities. A study I just received from Mass Housing estimates that by 2030, 85% of cities and towns in Massachusetts will have at least 70% of income-eligible households unable to access age-restricted affordable housing because we just don't have it there. So that's a big challenge that we'll have moving forward. Survey results also show that people want to walk, and that there is a need for safe and well-maintained sidewalks in most communities. But unfortunately, since our communities were planned around the expectation that people are going to drive, there are big gaps in sidewalks, or there are miles and miles of sidewalks that are expensive to maintain and are not a priority. There are competing funding priorities in these towns, so often there's not a budget for maintaining sidewalks. To encourage infill development for housing and for older adults and for more walkable communities, some zoning and subdivision changes are going to be required, but those take a lot of time and community support to pass. So as regional planning agencies, we can help communities with the public engagement process and with writing reports, but we really need to figure out how to keep the conversation going in order to make changes that will require more time and effort going forward. We need to communities can incorporate age-friendly planning through master plans and also to follow up with zoning and subdivision regulations to encourage development of housing in town and urban centers. Next slide. So we hope to expand the age-friendly work throughout the Pioneer Valley Planning Commission region and to engage older adults as well as the broader community in the process. We're looking for ways to engage populations that don't come to public meetings. And I visited a ESL class in West Springfield and heard from the folks there that their older relatives would love to go to senior centers just to have an interpreter there to hear what's going on. And I think that's a real great opportunity for cross-cultural connection and learning. And as communities come to understand the need for planning for an aging population, we hope to see more affordable and accessible housing located in town and urban centers and higher priority given to improving and maintaining sidewalks. And by combining age-friendly planning with planning for more resilient communities, there will be more green infrastructure, and that will improve walkability as well as the climate. And by getting people more out of their cars and creating more attractive and walkable communities. The councils on aging in our communities in the region are doing a really great job of providing meals, programs, and services for older adults, and most also provide transportation services during business hours. And as I said, there's some great efforts underway to expand the transportation through these multi-town initiatives. We need to continue these initiatives throughout the region, and this is an area where we could employ electric vans or cars to help the climate as well as help the aging population and all members of the community. We also need to acknowledge that walkable communities are healthy communities and find ways to improve both sidewalk networks as well as locate affordable housing in town and urban centers. So there's opportunities for collaboration and sharing of ideas on a regional level, and hope to provide a space for some of those working on age and dementia-friendly planning in the region, to share ideas and collaborate wherever possible on regional initiatives. But it's going to take some work and some time to get there, but I think as we continue to all work together, we'll see some change, and the change needed to allow aging adults to remain active and engaged going forward. Thank you.
Wonderful. So that was the breadth of what's going on in the region. And now Tim, president of Age Friendly Foundation. President.
Yeah, great.
Thank you very, very much. Thanks for the nice introduction as well earlier from Robin. So my name is Tim Driver. I'm going to have the honor in a moment of introducing Dr. Kalache to you all. And before I do that, I just want to say a couple things about the foundation that I'm here representing today, the newly formed Age Friendly Foundation. I'm also going to just talk for a moment and echo some of Robin's remarks about the governor's leadership. Talk a little bit about the tour that Dr. Kalache is on here, which has been supported by a number of you in the room. And then I'll say a few remarks. I won't go through the full bio of Dr. Kalache, which is in your paperwork, but I'll make a couple of comments that have resonated with a lot of people over the last 10 days. So first of all, a couple of moments on the foundation. So the Age Friendly Foundation is a newly formed entity this year, and our purpose is to sort of continue the energy and the drive here about fueling research and education and advocacy. Obviously, there's a lot going on here. I'm incredibly proud to have amongst me our Executive Director, Amanda Henshin, Joe McCarran, a couple of other directors who aren't able to make it here today, but also Dr. Kalache. So it's extraordinarily exciting to see the journey that we're embarking on here and joining, obviously, with a lot of the incredible work going on here across the state and quite honestly, around the world. It's been incredibly eye-opening to me, and I think to all of us, just to see what's happened across this state based on Governor Baker's declaration that this is a priority. It's really, really inspiring to see what's happened across the worlds of nonprofit, for-profit, policymakers, and it's truly a joining together of lots of different constituents, disparate in what they do every day, but coming together and just to sort of work towards a goal that just makes a ton of sense given the demographics that are before us and impossible to ignore. So Governor Baker's council to address aging, one of the many recommendations to come out of it was fueling the idea of employers getting more into the act, and that's one of the big activities that we do in the foundation, is to encourage this idea of age-friendly employers and to frankly make employers more aware of why it's a good idea to employ older adults and see them as an asset that's going to make them better and more productive, as opposed to what often goes on in this country and this world, which is shunning people after they get to a certain age. So we've taken that on as a big part of what we do. There's now over 100 major employers across the country that are certified age-friendly employers, and when I sit here, hopefully before you next year, there will be many, many more than that. It's our goal to get into the hundreds, the thousands, and it just frankly makes a great deal of sense. So the tour that Dr. Kalache's been on started a week and a half ago. He's been visiting and doing lectures at some of the area's universities, Fitchburg State among them, LaSalle University, Harvard, MIT. We had a forum with the editorial board of the entire Boston Globe, who was riveted at what Dr. Kalache was saying, and again, it just made sense to them. It made sense to what they're doing. The Boston Globe is one of the very few papers in this country that has an aging beat, and so they've obviously been among the many that have recognized that this is something that's just in front of us all. So they were inspired. The next day, another group that was inspired was a group of Governor Baker's secretaries who came together to listen to some of Dr. Kalache's remarks and just sort of feel, as I think we all are in this room, just energized by what's going on here. The tour itself, I want to recognize the Tufts Health Plan Foundation for helping to financially support the tour. I also want to give a shout out to James Fuccione, who pulled together the event in Fitchburg, which was well attended and exciting. Also, Philip Gonzalez is here, and obviously was the one who really made this all happen today. Also, I want to acknowledge the work that AARP does behind all of this, because I think you've all met along your way Antron and the other fine workers in the state, and maybe also from the national office of AARP, that makes this a major priority within their organization. So now to Dr. Kalache. It's awesome to just watch someone change the world, and this is someone who sets the world on fire in a good way, and you're going to hear from him in just a moment. One of the great moments from the conference that we held on Friday was the unscripted moment when Dr. Kalache we were, I think, doing a quick photo op on the stage after Governor Baker spoke, and Dr. Kalache took the opportunity to grab the lectern like this, and with Governor Baker standing to his left, he said, "Governor Baker, what you've done here in Massachusetts is extraordinary, and I'm going to tell the world." And he has the ability to do that. I mean, he's formerly with the World Health Organization and started all of this. But on Friday, he's going to be in Dubai. He goes home to London tonight. On Friday, he'll be in Dubai. He'll be in Sao Paulo 2 weeks later. He'll be in Davos in a couple of months. And what you're doing here and the presentations he just saw are about to get visibility in a way that you probably didn't even imagine when you came to the room today. So this is extraordinary and really, really exciting. So again, I'm not going to read through the full bio, because you can do that on your own, but I do just want to introduce Dr. Kalache and just say thank you for being here, and we're looking forward to having you back next year and hopefully many more years to come. So, Dr. Colace.
Thank you, Tim. It's always frightening because you make all these announcements and the expectation is huge, and I have to be here to fulfill it. Oh God. And mornings are not my time. So, to start with, I never feel energized, especially if you wake me up at 6 o'clock to be here, by God knows what time. And guess what? Well, I came very excited to see the wonderful things that you are doing. This is the first city that is integrated age-friendly with dementia-friendly, the health system is friendly. And then my good friend, Pat Sullivan, who drove me here. Where is Pat? Here. We had to park, and we so fantastic. We have a parking space waiting for us right in front. And then she gave me some quarters to pay, and I said, no, you better do it. I may do, I'm not familiar. Just as well, because you cannot pay with coins. And then very small, you have a little note saying that you have to use your telephone in order to do whatever trick you have done in order to park the place in an age-friendly city. Small things count. It is exactly when you need to park and you think, I'm lucky, I have found the space. But then you have barriers. Because if you are 78 and you cannot read well, and the little note that you have to bend yourself, but you have arthritis, and you have to find that little information, but you don't know what to do with the telephone. The telephone, the meter, why don't we make things easier, more friendly? And if you on top, you are 78 and you are starting with dementia and confused, you just go back home in the same car that brought you here to participate in society. I'm not criticizing Springfield, I'm criticizing societies. Because so often we think that to become age-friendly, you have to have an amazing number of sophisticated gadgets and policies. No, simple things matter. And that is what would be my main message. Congratulations for having done the single things that matter that you have described to me. That is what I'm much more interested, because it is the collective sum of what you do is that what is going to make the aspiration from the governor to make Massachusetts for aging innovation what the Silicon Valley is for high technology. This is thinking big. This is visionary. But if it wouldn't be for the small actions that you do, please correct that tax meter there. If it is not for those small steps, then it's going to be a lot of big words and very little impact. Big words like, we want to fight loneliness. What the British government did? Created the Ministry of Loneliness. You have a minister now. You have civil servants. You have a whole hierarchy. You spend millions of pounds altogether to pay all the salaries. But you also close 500 libraries in the same year. That is where we fight exclusion. That is where people that are feeling lonely will go. That is where people with mental health problems go without no questions, ask, what the hell are you doing here? That is where single mothers can go and meet their peers with small kids and feel they have friends, feel that they can be understood, feel that there is no loneliness if you can have this touch, that you have 3,667 friends in face and nobody to look at you in the eyes or touch your hand. No, you create a ministry of loneliness. Small things count. We were talking about libraries today. And so much work that can be done in libraries, museums. You have phenomenal, in this state, art galleries. Let us make them age-friendly and dementia-friendly. And then Patty asked me on the way here, you have recorded, haven't you? Yeah, she didn't tell me that she was recording everything that we talked, only at the end when we had to pay for the meter. She asked me, why didn't you start 12 years ago with age and dementia friendly? And I think that I want to explain to everybody. There were 3 reasons. The first is that it was already insurmountable difficulty, barrier, challenge to convince WHO, where I was working and had been working for years, that we need to bring the 2 demographic trends of this century together, aging and urbanization. Therefore, in my mind, it was very clear that we have to make the place where people are going to age more friendly. Great. But it was not so obvious. First of all, because the authorities of the health organization, now I can say this. No, at the time I also said, but then I was punished. Listen, health is created in the context of the everyday's life. It's where you work, where you go around, where you live, where you get entertainment, where you love, where you play. That is where health is created. Not in the context of a health system. Me, the patient, you, the doctor, and you tell me what to do and I won't. Well, that is not the way. Health is created in the context. We have to create urban spaces where health can be promoted. But that was not, and to a large extent, is not yet the understanding of the director and the assistant directors and so on. They are medical doctors. They have been trained to cure, not to care. They are mostly males, and they are right at the top of that hierarchy, thinking that health systems is what makes the difference, not to work in the environment, to promote health in the way I have said. So it was difficult. And Patty, imagine if in addition, say, and we have to make it dementia-friendly as well, okay? Also, because 15 years ago, when I was doing the primordial work towards age-friendly cities, the perception of dementia was not as clear as it is today. Alzheimer's International had just started. The Alzheimer's societies that we see now around the world were incipient. I was and continue to be a close friend of the president of the then Alzheimer's Society Association, Professor Nori Graham from London University. And she had tremendous difficulty, money, difficult, multicentric studies like we have now, called STRIDE, that is coordinated by the London School of Economics, and I am in the board. This would be a dream. So imagine if, with all the difficulties to bring age, and urbanization. And now, by the way, I also wanted to make it dementia-friendly. It wouldn't work. Also, we didn't have any empirical evidence whatsoever that the dementia-friendly environments could facilitate the life of people living with dementia. And let us pay attention to language. Should never say people with dementia, people living with dementia. They are carers and health providers. We didn't have any evidence. We had incipient evidence that an age-friendly environment could make a difference for better for the lives of people that are aging. So, Patty, I told you this in the car, and I wanted to share this with you. There was another reason. I have just launched the Active Aging Policy Framework in WHO. I was not talking about a healthy aging framework, but active aging, changing the language. I had inherited a program that was called Health of the Elderly, and the day I was recruited, and I said, actually, I don't know what I'm doing here in WHO, because I don't think that there should be this program, Health of the Elderly. Nobody's going to look at the elderly. Saying, what do you mean? You want to resign? No, I want to change the name of the program from Health of the Elderly to Aging and Health. We are all aging. It's a universal experience. And aging is to be celebrated. What do you prefer? What is the option to aging? Die early? I'm not interested. Therefore, let us celebrate. Stop talking about aging as a problem, a burden. Oh, God. No, let us celebrate the fact that when I was born, it's talking about past, present, and future, my past, I had 43 years of life promised to me when I was born in Brazil. Today, a baby born in Brazil expects to live 77. That is the longevity revolution. It's fantastic. It's the greatest achievement of humankind throughout the history, to add 43 years of life to my life, to someone in my lifetime. This is tremendous, but the challenges are terrific. So instead of talking about only healthy aging, that for many, especially doctors, means I'm going to cure you, no, let us talk about active aging. You may have diabetes, osteoarthritis, cardiovascular problems, hypertension, whatever, dementia. But you can be an active member of society if society allows you to be. And that is what you have to fight. To seize the opportunities for the 4 things that matter as you age in order for you to have quality of life. It's health. It is knowledge in this day and era, that explosion of knowledge. We have to learn how to learn, and to learn the whole of our life so that we reach the age of 47, 65, 78, 90, continue to be relevant to our societies because you are healthy and because you are healthy, which doesn't mean not having diseases or disabilities. Healthy in the sense that you can live with your condition and be participating in society. To have the knowledge that you can continue, among other things, to work, which is the work that Tim is doing so well and has been for so long. But also need to put emphasis on right, a rights-based approach. Don't treat me well because I'm a poor old thing. Don't treat me well because I have needs. You treat me well because I have rights, like everybody else. A rights-based approach, and nothing for us without us. We are the protagonists. And this principle is the same for fighting any kind of discrimination. It could be age, it could be women, it could be LGBT, it could be race. And the equity is what should really guide us to fight so that an age-friendly society cannot be thoroughly friendly if you are racist, if you are sexist, if you don't respect somebody. I heard a phrase that was phenomenal in Obama's eulogy to Cummings last week. There is nothing weak about being kind, about being compassionate. And this is what an age-friendly society is in practice. I'm leaving Massachusetts tonight very excited, energized. I heard fantastic things. I have also made great friends, which is always the sign for me of excitement. Nora's here, Judy, you're here. We are here with Amanda, Tim, and Joe, the colleagues from the Age Friendly. We heard and we have been hugged and embraced, and we have laughed, and we have been excited about all that we have discovered together. And that's my pledge, which I made public to the governor. Since it's not enough to say that you are going to be the Silicon Valley for innovation and aging. You have to convince other people. It's not enough for you to, wow, Massachusetts now is age-friendly, dementia-friendly, is friendly to everything. No, other people will have to recognize this. And for that, you need to do the research, to provide empirical evidence, and you need friends that will tell the world, in my small way, if I can contribute to that, definitely. But there is another very powerful idea that I would like to suggest here. Find an ambassador or female or male ambassador. Find somebody, could be in sports or culture, someone from Massachusetts, from Boston, may not even be living here, that will help in the process. And I'll give you two experiences that are recent and exciting. 5 minutes, okay. Queen Sofia, this Queen of Sweden, lost her mother to Alzheimer's disease. It's a long story, but she has dedicated her life since for the Queen Sylvia's Foundation on dementia. She has just done a brilliant forum I had the privilege of attending at the Royal Palace in Stockholm. Her mother was Brazilian, and she was born in Germany but brought up in Brazil, so she goes there often. She considers to be pretty well a Brazilian. And the mother was Brazilian, didn't speak any Swedish. She was fluent in Portuguese and in German. And the husband, Queen Sylvia's father, was hiding from the rest of the family that the mother was developing dementia. And suddenly he died. And then Queen Sylvia comes to the funeral. First, she thought that the mother was in a state of shock and was not realizing what was happening. The husband had just died. And then she realized that, no, she has dementia. Brought her to the palace, to live in the palace. Well, if that is not enough to make someone confused that suddenly you are surrounded by people that speak a very strange language, living in a palace, and everybody trying to convince you your mother is the queen. And she said something that is really deep. If it was difficult for me as a queen, imagine what it is for anybody else to provide care to someone you love. Queen Sofia from Spain was also there. She has also dedicated the foundation under her name, Queen Sofia's Foundation, to raise awareness. And I will give you the site for you to see the film that in 90 seconds tells the story of a small boy that has this wonderful relationship with his grandfather, and they are building a rocket in the back garden of the old man who lives in a small town. And when the boy comes back next year to finalize the project, he realizes that the grandfather, as the boy says in the film, he has left before me. And all the emotion that can be conveyed, ending in a note of hope, is the boy 20 years later working in a university in a project to find a treatment for dementia. And that is what is my last message. Let us keep the hope. Keep the hope, because if I am here to speak about the past, present, and future, the future are us. We have 100 people here. You expect easily to live realistically in this state to the age of 85, 90, 100. 45% of us will have dementia. That's the future of dementia. And if we don't prepare an age-friendly, a dementia-friendly, as you are part in this state, we are going to fail ourselves. So it is vested interest. Because if you want to see the face of someone with dementia in the future, look at yourself in the mirror. Thank you.
Thank you so much, Dr. Colace. So now we actually have a healthy amount of time to have an interactive discussion and question and answer. And I think people should definitely feel free to direct questions, obviously, to Dr. Colace, but if you have some questions about some of the local work, that's wonderful too. So raise your hands, get ready, and we'll get you a microphone. And I know I have a question, so if no one else does, I might go ahead. So Dr. Kalache, I'm going to put you on the spot. So we in Springfield showed you life expectancy map, which is basically a disaggregation, if you will, by race and ethnicity. You'll see in our region, you saw the different life expectancy and what you just said around living longer and 45% of folks. Do you know of other cities that are also experiencing those disparities or inequities of life expectancy and things that should really be part of the vision and the action to lift up that particular population?
Thank you. Actually, I don't know any city that will not have that. It's the other way around. All cities, even the richest cities in the world, will have suburbs, will have excluded people, will have neighborhoods, side by side. I often give the example, when I lived in New York and I was working at the New York Academy of Medicine, which is facing Central Park at 103, so it's at the end of Central Park, and it is equidistant to Upper East with the life expectancy. At the time I was working there, it has now increased. It was already 87, today is 89. 2 kilometers away, look at the left, don't look at the right, because then you will find Harlem with a life expectancy of 69. Side by side. Talk about inequity and examples. I come from the most unequal society in the world, and I'm not proud to say this. Brazil is a super rich country with super rich people. You have 98% of the wealth in the hands of 10% of the population. The others are really living with small change. It is the second world producer of food in the world. And you have people going hungry every night, not knowing what is to be hungry. And you have whole communities. The inequity has a gender, more women, has race, more black and brown people, and of course has age. So you exclude all these people and then you call them minorities. They're not minority. In this country, 45% of American populations are either poor or very poor. It is almost exceptional to be the group, the 1% that also has 90% of the wealth in this country. So it is the other way around. I don't know any city where there is no poverty and the equity issue is not the #1 priority.
Thank you, Dr. Kalache. And thank you for talking about dementia-friendly. And I'm curious, how would you address, or what are your recommendations when there is a hesitation to include age and dementia-friendly, because there might be more positivity around age-friendly and more scariness around dementia-friendly, or that's how it can potentially be viewed? How do you address that kind of stigma that still exists and try to incorporate them both?
The first thing that I would say is have focus on what you're doing. If you don't think that you are ripe yet to integrate, don't integrate. Don't attract opposition, antagonism. Because not everybody will be in the same space as you are. Give them time. When I was launching the age-friendly cities movement in WHO, there was another very strong reason why I should not even try the dementia-friendly track. Because there was a director, a very powerful psychiatrist, very empowered guy from Eastern Europe, very authoritarian, who said, I want mental, he was a psychiatrist, and he was the director of the division of mental health. I want dementia and depression and old age in my department. Saying, yes, sir. Because if I would clash with him and say you have to change tracks, and it has to be community-based and more age-friendly, dementia-friendly. I was weaker than him. Measure your strengths and see if it is the right time to do together, integrated, or if you should wait another 5 years. There's one thing that we learn with old age. Not many, but one thing you learn. You can do with time. Wait a little bit. And by the way, don't think that you will become wise as you get older, because most people are not particularly wise when they are young. There is no obligation to be wise as you get older.
My question is for Becky. I am really intrigued by this whole idea of tactical urbanism, and I think that what's really important is to figure out, like, what do you start with? How do you decide what are those pop-ups that you engage in, and then what else might you do to make sure that you include the voice of older people in those ideas? Oh, I'm sorry, Marie. Sorry.
Sure. Hi, I'm Marie Westberg. So I think there are ways to kind of engage everyone, I think. But what we did in Northampton was we had a forum at the Senior Center, and we asked people to come and speak about what they'd like to see change about the environment, and also what they value about the environment. So what they don't want to change, what they want to preserve. And I think those are important things, because that's about identifying what's come before and looking to the future all at the same time, and respecting where everyone, what everyone values. So I've done a lot of projects where we've had multiple conversations with kids and seniors in the room and asking them the same questions. How do you get to town? What do you do when you get there? And sharing that experience together and valuing everyone's experience brings everyone to the table. So I think if you have those conversations, whether it's on the day that the tactical urbanism is happening, or it's forums leading up to it, I think those are all important parts of the process. And I think adding art making to it is always a good thing. Preserving those moments where stories are being shared is really powerful, because then people can look back on it and it becomes a shared experience. So I think that gets everyone sort of invested in seeing the project through in a way that's very different than sort of just looking at new site plans. Or I think that the people who show up to public hearings around changing zoning are the totally different people that are going to show up to these kinds of events.
Just a follow-up, have any of those been sorry, just have any of those ideas been made permanent?
Well, yes. So I think that the plan is that sometimes these kinds of changes take time, and so the city planning department then integrates those. They'll get feedback from the community during those events, and then that will inform the process. And so in Northampton, there's an alley called Cracker Barrel Alley that they got a lot of input on a day they did tactical urbanism a demonstration, and people. It was sort of a dangerous spot because pedestrians would walk it, but also cars would walk through it to get to parking and then onto the street. And it was turned into there's a mural in that alleyway, and it's no longer accessible to cars. So I think people really saw the value of that project. And the city planner in Northampton is doing a lot around these things. And so it's really a happy collaboration to be doing the age-friendly projects. And so we have a lot of resources to kind of do these kinds of projects.
Your comment has triggered, when I was coming with Patty, I made this suggestion. You mentioned about the importance of making a record and having stories so that we can share and personalize. And it is based on a project that we are doing in Brazil. It's called Life Stories. So we give an award to young people. It's a competition. You know, the judges are from the National Academy of Letters. Anyway, so the writers, the best writers belong to this National Academy, and it is a group that includes them to judge the best. And you write about somebody old that has inspired you. You have beautiful, beautiful stories. I was suggesting to Patty, I think that you thought that you're going to take this on board. I'm making this public commitment now on your behalf, which is secondary school children, let's say aged 11 to 15, this age group, to write about a personal experience they may have had with someone with dementia. So that you can go to schools and disseminate, and you can raise awareness, and you can collect these stories in a website, or perhaps even in a printed version in the future, and to give awards so that there will be real excitement about sharing this experience. And I know from fact, in this work that I have done in WHO, now in Brazil, but also in Spain, in England, and Australia, that this kind of ideas, when you personalize and you have personal history, rather than only facts and data, it can move a lot of barriers, because you are still dealing with stigma and something that is hidden, that you don't want the neighborhood to know that somebody in your family has either dementia, Alzheimer, but the same applies to mental health. And my God, if we're still talking about dementia here, we haven't scratched the surface, because depression is far more common in all ages, and it's going to be the burden #1 of disability in the world in another few years. Behind that, you have loneliness, and you have a stigma that dealing with depression can be as difficult, sometimes more, than dealing with people living with dementia.
Yes, I have a question for Dr. Kalache. I wonder, in your travels, your international travels, in some countries, from what I understand, families grow up together and age together. And in other countries, and I, you know, in my experience and where I've lived in the United States, you know, as a parent, I prided myself that my kids have grown up and are independent and now live, you know, far away. And I don't envision a time necessarily where we would come back together generationally. I wonder if you could talk about what's the benefit of that, or what have you seen works, or does a family environment work better or no, or just in your experience?
You know, in this country, people used to live together. The extended family was here. Lots of kids. Women had not joined the workforce. They were there to provide care to a very small number of old relatives that will continue to be assisted at home. That was in Europe, the traditional. It's only very recent that we have the nuclear family. The big cities, the urbanization, the migration mass scale that people live miles away apart. Sometimes in other countries, in big countries like the States and my country, people can be living at 3,000 kilometers away. But also the extended family that has been replaced, and you cannot reverse the clock. Everybody's busy. My mother is centenarian living with dementia. She has 11 grandchildren. Nobody has time to visit. Even those that live in the same city. You cannot reverse the clock. It is modernization. All countries will experience this one way or the other, faster or more slowly. I have seen this happening. in my country throughout my life. When I was a child, the competition in the family for women that, as I said, had not to join the workforce was, if there was somebody ill in the family, they would compete because they could spend the night in a hospital. Oh my God, what excitement. At least you were going to spend the night, even if it's not with your lover, but with your granny in the hospital. It has changed. We cannot go back. We cannot say that families are good or bad. And I told you, for some older people, the best place is not to be with the family that is full of bigotry, negative attitude. Most of the abuse of older people happen at home, in the construct family care, in the context that you depend on somebody that the last thing that this person wants is to provide care to you without public assistance. So there is increasingly fragmentation of care and family insufficiency. The family cannot do. Better saying, there is insufficiency of public policies to support the family so that they can play that role as carers. And if there would be a good policy, which is what I hope is in the aspiration of Governor Baker, to make this not only age-friendly, but a state where the culture of care will be valued, then it will be easier for family members to provide care, because they will do that being valued, rewarded, and with fun.
I had a question, since we have many people here from small communities and rural areas, Dr. Kalachi. In the countries where you've done work and where you've advised, what are some frameworks or some ways that people have approached the work in rural areas versus in urban centers?
There is an agency next door in Canada called the Public Health Agency Canada. Central government, federal government in Ottawa. And if you want to see what the country is doing that is good for rural communities, isolated communities, and they're talking about isolation. We are talking about living 2,000 kilometers away from services under the winter in Canada. That's the country to watch. In fact, I think that Canada provides many very good examples of age-friendly cities, communities, rural, age-friendly approaches in general. They have, all the provinces in Canada are now with strong policies for age-friendliness. There are 980 communities spread of all sizes, from Toronto, Vancouver, Quebec, to small communities, some of them really lost. They are doing very good work on age-friendly environments and also dementia-friendly, and measuring. There is not a single university in Canada that I have not visited without a very strong center for research on aging. The only thing that they cannot change, which is a disaster, I once went to give a lecture to which included Winnipeg, and the temperature was minus 47 Celsius. And I promise I will never go back there again, because that is not friendly to anybody. And then I was told, I said, oh, don't come in the summer either, because it can be 44 Celsius, and there are big mosquitoes, size of helicopter, that will bite you through your jeans.
Hello. I'm very curious, Dr. Kalachi, if you could talk about intergenerational approaches. I work with a foundation, the Treehouse Foundation. We have an intergenerational community, and some of the things that we have seen there in our 13 years is the barriers dissolve, and what is clearly what's good for children is good for older adults as well, and it's designed to re-envision foster care, so it's bringing vulnerable populations together in ways. But together we learn about trauma, which benefits us. Together we talk about aging, and the older adults talk about children as our children, not those children, but and it beautifully breaks down barriers. But I'm curious what your perspective is internationally.
From the intergenerational perspective, again, this goes back to changes that we cannot reverse. But one thing I will tell you, my interest on aging came from when I left Brazil as a medical doctor. I had never heard of the word geriatrics, didn't exist. It was a very young population with tremendous problems of infectious diseases, child mortality, and so on. And then I found myself in London and called my attention immediately. My God, there are so many older people here. And 2 months later, I read in a footnote in a medical article in The Lancet, was not even to do with aging, but that footnote changed my life, because it said that 83% of geriatricians working in Britain were from India, Bangladesh, Pakistan, and Egypt. So I think, how could medical education fail and not attract to geriatric medicine, given the age structure of the country? So I decided to do, for my second year, for my master's degree, research on why people choose geriatric medicine as a specialty, and what makes the difference of working in geriatric medicine, having quality of job quality, satisfaction, and not. The only question that would separate the two halves, they were all members of the British Geriatric Society, 850 of them. You know, those days there was no internet. You had to put stamp on the envelope and send and wait and do. It was hard work. And the only thing that would make a difference was having had close contact with older relatives in childhood and adolescence. Nothing to do with high tech or, no, attitudes that you bring. Then I did a second study with medical students in one of the medical schools in London. And for the first time, they had introduced geriatric medicine in the rotation training. So a small group would come to geriatric medicine while others would be in neurology, gastroenterology, cardiology, and so on. And then when this group would finish, I would get another group and I would measure their attitudes towards old age, aging, the process of time, the die at the end of your life, and so often this end of life is in old age. So all this, and in all groups, attitudes were better before they had stepped into a geriatric ward than after. In other words, was counterproductive. Then I would organize focus groups with this small group and tell them, look, you have to explain to me, I am a young Brazilian medical doctor, I was young then. And I don't understand what is happening. And they would invariably tell me, are you surprised? We are 2021. We came to medicine to save lives. You have put us here in this geriatric ward, people confused, they multiple pathology, they are dying, some have bad ulcers, abandoned by their families, they are depressed, they are demented, and suddenly you want us to get excited. We have never talked to an older person for more than half an hour. This is the first time, it's not a good way to start. In other words, they were telling us, we come from nuclear families. We don't understand about aging. We have no familiarity. It was the same story as why British qualified doctors were not choosing geriatric medicine for lack of familiarity, that these future medical doctors were telling me, that's not the way to start. We change it. And that is why we have to be more imaginative. Instead of exposing medical students to geriatric patients, we introduce them now to 6 older people at random, and they will follow them for 6 years of the medical training. And there will be events. There will be birthday parties, weddings, funerals. There will be diseases and there will be joy. And they become friends. And if there is death, it's the death of a friend. It's not another death of a geriatric patient.
Good morning.
Man for a change.
Good morning. I have lived in a co-housing community for the last 25 years here in the Valley. A housing concept brought here from Denmark some 30, 35 years ago, where neighbors live together and create community. And I'm happy to see the villages concept presented here today. I think that's highly commendable, as is the treehouse community in East Hampton. In my experience living in a community, I find that younger people and elders learn from each other, and the benefits are extraordinary in both directions, helping young people to learn and giving older people a vitality that probably wouldn't be there because they're able to be mentors. So I'm happy to hear your answers, and I would agree with that. So, thank you.
Good morning. I'm Joe McCarran, and I'm delighted to serve on the Age-Friendly Foundation Board together with Dr. Kalachi. Dr. Kalachi, thank you so much for your leadership, your energy, your enthusiasm for the age-friendly movement. It's truly inspirational. My question is surrounding branding and messaging for this age-friendly movement. And I think it's important to recognize that age-friendly is for all ages. And how can we be integrative such that it's not fueling the divide or otherwise being cloaked in ageism? And I wonder if you have any thoughts or suggestions as to how we can broaden the awareness, clarify the messaging, and what strategies might we employ so that there is wider awareness of what we're doing and how it applies to everyone in a multi-generational, intergenerational, and integrated fashion.
Thanks, Joe, for the question, because this is essential. And take advantage of your language. English is fantastic. You say age-friendly. We cannot say this, isn't that? In our Latin languages, you cannot say age-friendly in Spanish or in Portuguese. You have to say amigable de las personas mayores. You lost it. Age-friendly, friendly to age, all ages. So insist on this. We are creating a society for all ages. Bring the message that you are young today and the best thing that can happen to you is to age. As I said before, the alternative is early death. So embrace this with enthusiasm. Give examples. The bus that you have in front of you, if that bus is easy for you to get in and out and do your trajectory with safety because you are old, it's going to be easier for a pregnant woman, for people with a disability, for a teenage with a roof sack in the back, and it's going to be easier for everybody. Don't expect that design and technology is going to be more age-friendly if you don't have a real dialogue. Those that are designing, so often young people that don't know anything about aging, and those that will use, older people, protagonists. Establish ways for this dialogue to happen. If you don't create the opportunities, the dialogue is not going to happen for the reasons that we have seen before. There is little intergenerational dialogue, even within the family. So you have to create the space. age-friendly Massachusetts will depend on this dialogue happening, and for younger people to realize that, yes, you're going to be old one day, and do it with enthusiasm. I'm afraid I have time for one more question. You can stay here forever, but I will have to go because I have to check out from the hotel and get prepared to go back to London.
Hi, good morning. I do have a question. I think it's probably addressed to everyone that spoke. Where is all the money coming from? I know Pioneer Valley Planning Commission. I know the American with Disabilities Act. I know that there are some grants out there. So that's part of my question. Where are you getting all the money? And the other thing is, what are we doing with local colleges and universities around here locally to work with kids to be doing this?
Well, money is definitely not my department, so who is volunteering?
So I think, first of all, I think we've had wonderful partners in philanthropy and business and academics. So some of it has been outright checks, some of it has been sweat equity, labor. But I think what we've learned about this is that while it requires resources, they are resources that are already in the system. And we're not talking about huge capital expenditures here. We're not talking about having to do major multi-million-dollar plans. So while we've had some wonderfully generous gifts that have gone directly to communities, both from AARP and for the Tufts Health Plan Foundation and other foundations, when we go to kind of look at what the money's being used for, a lot of the money's being used for looking at data, convening, facilitating. It's kind of on a different scale than if we were building, a new transportation infrastructure. Not that we don't need to do that, but so I don't know. Is it fair to say that the money comes from really many, many different places, but that the investments I think have been manageable?
I would just add. So I would just add this. What was great about the Governor's Council was that they also had these committees convening, and it's about understanding things like transportation, which is a great example. When planning includes the lens of understanding what older people need, you don't have to add money, you just have to be inclusive of those older needs. I think that one of the things that was really this idea of the tactical urbanism, that happened in Watertown when they were trying the bus rapid transit lane, right? They didn't know. It didn't really cost. It just like for a moment in time, you had another foundation who was interested in transportation to see if this is something that would work and would older people use it. And what we don't understand is, like, we talk about it, and language is also very important, around transportation as an economic engine, but there are people who like to go and get their hair done, right? Their transportation needs for everyday life as well. And so if it works for everyday work, then it will also work for everyday life. And so I think it's not saying more money, it's saying, well, how are we using the existing resources more smartly? And so that's why that whole idea of tactical urbanism, it's like, what does that tell us? How does that then inform a planning process? And then how do we think about reallocating resources in the smart and right way? The reality is, and I think that we understand this in terms of ageism, right? It's really acting against our own future selves, right? And so what we need to do is, as we plan, we need to plan with our own future selves in mind.
And I think it's so appropriate that Nora has added these notes. I mean, you are responsible to a large extent for seeing where resources can go. But I want to pay recognition, acknowledgement to the phenomenal work that Robin has been doing. So thank you, Robin. You have been a champion, and a round of applause.
Well, it is time, unfortunately, to wrap up this, long-awaited experience, which has been, really wonderful to hear from you, Dr. Kalache. So thank you so much for being here with us and everyone else, our other speakers today. I was asked to just give a few reflections, and so the themes that I have picked up, which I will share with you, and would love to keep this conversation going, obviously, but keep things simple. Simple is friendlier. Patience but action, both are required. Equity at the heart, and we can't reverse the clock, but we can rethink our priorities. So thank you for joining us here today, and take care.